coffee. Well prepared.
Ay, dali ko sa pitas.
River. Aso na nakalimutan ko yung size.
Hello. Dati mo ba yung tawag?
Sige. Ano yung tawag?
Bad outfit.
Ano yung tawag?
Ay. Top sheets. Balik ko.
Ayun mo.
Top sheets. Mag-change. Ako na. Pero di ba top sheets kayo kalit na assuming na
Ano po ito?
Dati na. Hindi. Pero di ba assuming
So, we're gonna start now, ma'am. So, good morning, ma'am. So, I am Jonah, and we will perform a bed bathing for the patient. So, first thing first is we need to make sure that the aircon and the windows are closed, and also make sure that we do the proper hand washing.
before coming inside of their room, and also the electric fan 1 hour before bathing the patient.
So, in starting with bathing the patient, we need to check first the temperature and temperature of the patient. So, assuming that it is in a normal temperature, so the normal temperature is 36.5 to the range will be from 36.5 degrees Celsius to 37.5 degrees Celsius. So, assuming that it's 37.2 degrees Celsius, so the patient is in a normal body temperature.
So before we start, we have to make sure to prepare the materials, which is 3 basins, 3 clean cloth, clean washcloth, and also we have here the
Washing,
soaping,
washing,
final rinsing.
final rinsing.
And then we also have here for the nose, to clean the nose of the patient. We also have here the soap, and so we also have here the pail and the dipper. So, and also we have a bath blanket, bath towel, clean glove gown to change the patient's glove gown, and also top sheets.
So first thing first, we need to cover first. Yes, since we already did check the temperature of the patients, we are going to cover with the top sheet. So let's assume that this is the top sheet.
Bath blanket. So we're gonna bath blanket first.
So this is to make sure that the private
patient's-
parts of the patient is covered.
So we will have to make sure to start from the far side. And how about the top sheet? Still there.
We're going to remove it
Yes.
since we are going to cover it with the top sheets. So make sure that privacy parts are covered.
And then the top sheet, we're gonna put the used top sheets. We have to put it on to the hamper.
Before that, by the way, so we forgot that if the patient needs to urine, so we're going to put this one the urine. But if the patient will not urinate, so we're going to put it here.
The left side. So
Left side.
now we will gonna remove the lab gown of the patient. So when we start removing the patient's clothes, we have to make sure to start from the far side and then the near side.
Make sure that the parts of the body are still covered. Ay, wala ko ka ng all in one. Sila yun, mali yung part. Ano ko, kita na lang to, kaya wala man yung partner. Kaya siya na, wala, ano man si all in one. So, tak na lang siya. And then, since it's used already, so we're going to put it on the
Hamper.
hamper.
So now we're gonna put the bath towel to the patient's head. We have to inform the patient, by the way, that we're gonna put this towel on their head.
I'm sorry, ma'am, we forgot. Before we start, we need to also introduce ourselves to the patient that we are their caregiver, assisting them to
Do the bathing.
to do the bed bathing. So since, as Shaina said, before we put the towel on the top side of the patient, we need to inform the patient that we're going to put the towel so that they are informed. Okay, so since we are now ready to do the bath, so in doing the bathing with the patient, we are going to start from the dirtiest to from the cleanest to dirtiest. So we are going to start with the eye. So I will use first the towel for washing. I'm going to fold
Clean
this one.
towel and rinse it.
So I will do the right side and China will do also the left side. So we're going to use clean
Do the
first the eyes from the outer
Inner
Ang
contour.
imuha, John, i-triangular na lang natin para easier for you.
So we will gonna start from inner canthus to our outer canthus.
From inner canthus to outer canthus.
Ano siya, John, ipadala.
Padala na lang. Okay. And then, so the outer canthus.
The upper side.
Upper side. Oh,
The
lower
upper side.
and upper side.
That's for the eyes. So that is that's
Then-
for washing.
Yeah. Then you have to soak it again with the clean cloth, and then now we will gonna start on the right side. So we're gonna start from the head down to the chin, then down to the chin except to the neck. So the same thing on the other side of the face. So now we will gonna soak the towel again, and then we will gonna clean the ears of the patient. So from inner earlobe to outer earlobe, same thing on the other exit from the back.
And then pat and dry.
So next is pat dry. Then, so the next is that we will gonna remove the towel from the patient head, and then
So we're going
make
to
sure
remove
to
the towel,
remove
sir.
So-
In 1, 2, 3. And we're going to
Now, we will going to do the
fold it in a lengthwise.
lengthwise, and we will follow cleaning the arm of the patient. So only expose the body part where you will going to clean.
So in cleaning the hands of the patient, we're going to start with the palm. Palm to palm.
Palm and
With washing water. In a circular motion. And at the back. Also with the interdigits.
interdigit down to the elbow in a circular motion, exit to the underarm or axilla. And then now we're gonna use the soaping
Soaping
the
towel.
the towel with soaping of water, and start from the palm to the back to the
Interdigits.
interdigits, and then in a circular motion down to the elbow, exit to the underarm or axilla.
And then the rinse.
Then now we will gonna rinse.
Same
the
process
rinsing.
from palm to palm.
Same
The back to hands. Then interdigits.
interdigits,
Then down to the
elbow to
elbow
the
in the
exit to
circular motion.
exit.
And then pat and dry.
But try. Now we will gonna cover the patient's arm
And remove.
and remove the towel.
Then fold it.
Fold it crosswise and then cover the patient's top body top, and then fold the bed blanket down.
Yes. Okay. Make sure that the patient is still covered with the sheets.
Uh, so now,
So the next one is we're going to clean the chest. So wash it.
so we're gonna use this soapy water.
So in cleaning the chest, we're going to clean the chest, rub the chest in a circular motion down to the abdomen, down to the navel, but not to the organ of the patient.
Nawala ka sa puso.
Puso. Yeah. Navel.
Level. And also under, if it's a woman, under the breast.
So ikaw may move ka ng
And same
soap
thing.
na soap. Washing.
So now I will gonna do the soaping. So I will start with this same thing. In a circular motion, start in the chest. If it's a woman, under the breast, and then to the
Navel.
stomach, and exit to the navel.
Okay, so that's for souping. So after souping, so final rinsing. So it's still same process in a circular motion from the chest down to the abdomen and to the last part of the navel. Okay, and then pat and dry.
But try.
And we're going to tap up the top sheets.
We're gonna, I'm sorry. We will gonna, and now we will gonna do the feet, the legs of the patient. Lower side of the body.
So we're going to fold the towel in a
Towel.
lengthwise
Then twice
and
again.
position it to the
Under the
under the feet of the patient.
So only expose the body where you're going to wash or clean. Okay. Now, those will start.
And then, so is washing the feet, we are going to start with the foot of the patient from the sole to the, from the sole
So,
to the interdigits. So down to the pasaka in a circular motion.
to the toes, legs, and exit to the thighs.
for the washing, for the soap.
soaping. So make a mitten again, and then start performing the
The sole of the foot,
sole of the
the
foot,
interdigit.
interdigit,
down to the
then up the feet, and then
top of the feet in a circular motion.
toes, legs, exit to the thighs. And then the same thing,
Final rinsing.
final rinsing. Okay, make a mitten, and then sole, then interdigit, then back of the feet, front of the feet, and then toes, legs, and then exit to the thighs in a circular motion.
And then find the pat and dry.
Pat dry. Sorry. Then pat dry.
Okay, and one last part is since we are going to clean the nails of the patient at the feet.
We
so
do
we're going
have
to use
the
let's say that this is the
orange.
extra basin. So clean the
using the orange tip with the
using the
assuming we already cleaned the
Ano na lang,
nails of the
nails.
patient using the orange tip.
orange tip.
Ang niya sa kong ilang stable siya hanan.
Okay, then wash them off it. And then pat and dry. And also we forgot same process with the hands also for the nails. So clean the tips of the Okay, then pat and dry.
Pat dry. Then
Now we're going to we're going to clean also at the back of the patient. So in positioning, so we need to make sure that the feet of the patient is in a
knees of the
position.
patient
And
is
then
in
we're going to slant
slant slowly. Make sure
the-
to hold
but
the
before that, we're going to inform the patient
Patient
first that
first.
we're going to slant the
clean their
position
back. So we have to
inform.
put them on the side position.
So we're going to slant it and 1, 2, 3. Yeah, and then cleaning the back of the patient. So we're going to wash again. So we're going to put the towel. This one. So start with cleansing the back of the patient. So from the upper back patient, the circular motion down to the upper, lower, then down to the buttocks, to the anus. That's for the cleansing, for washing them. And then for soaking, same process, from upper back to lower back, down to the buttocks to the anus. And then final rinsing. So in a circular motion from upper back to lower back to the buttocks to the anus. And then pat and dry.
Try using the pat towel.
And then we're going to inform our customer to be
we're gonna
back
put
in side
you
position.
back.
So in 1, 2, 3.
Towel.
Okay. Alright. Students, you already done.
Magparinyo.
Kung mag-perennial care, alam ko mag-change sa top sheet.
Options
Tipo
ba?
pag
Change
alam
ang
mo
siya.
pwede nila siya makita.
Ako na magulang ko siya. Imuha ang laki doon.
Ako ito ang babae. Ako Okay, so for the genital part, so if it's a girl, so we're going to, this is the part. So in cleaning the genital parts of the girl, so we're going to, so first we're going to identify the parts of it. The, mons pubis for this part. And then we have the majora, labia majora here. And labia minora, the pubis, the abdominal vagina, the urethra, and the anus. So in cleaning the part of the girl's genitals part, we're going to do the 7 method. So from right, so we're going to from the mons pubis down to majora, labia majora, and same so to the down to the anus, and then same process. So we have the I use this part, so I'm going to use this part also, the next one. So same process at the left side, from mons pubis down to labia majora, down to the anus. And then for the next one, so for the labia minora, we're going to hold this one, and then
Baka ibabaw siya. Okay, ibabaw ka kay mag-anak ka suppose.
so anak, dili.
Oo.
So, so we're going to spread this one. So in cleaning, we're going to use this from the cleaning the labia minora and down to the anus. The same process at the side, and then click this one, and then down to the clitoris, and then to the opinal vagina, down urethra to vaginal area, down to the anus there.
So same process, the washing, soaping, and
Yes, ma'am.
Same
Same process. And then pat and dry after the final rinsing. For the, ito lang pag-provide mo sa
For the male.
So,
Ay, one, ay ka ng words to open.
Ay, kanya. So, ganun lang yung data na. Like,
Ay.
ikan mo. Init.
Okay. Wala. So, degrees of freedom.
Yeah, that's fairness.
Okay. Asa tawag ako?
Glans penis.
Glans penis.
Sinasagpuran mo siya.
So, for the male, so we will gonna start to the gland penis,
Glans penis.
glans penis, down to the, in a circular motion, down to
So, punuan ba soaping?
shaft, shaft,
Down to the shaft.
so to the scrotum.
Glans penis.
Glans penis, to, in a circular motion, down to the
Glans shaft.
Shaft. to the scrotum.
Same
Down to the
process.
anus.
And anus.
So same process with washing, soaping,
Soaping
and
and
final
final rinsing.
rinsing. Okay, nasa dito.
You change that.
So now we're gonna change the patient's
Kanilang
gown.
Ayan. So we're going to change the patient's gown.
So changing the same thing for farthest side to the near side.
Then
And
we're going to
slowly pull
slowly pull down the
the butt down there. Put this in the hamper. So kaya lang gamitin mo.
Let's assume
So
that-
now, let's assume this is a clean top sheet. So we will gonna also change the patient's top sheets. Sorry.
Wato siya ang kwanhang.
Okay. And then,
Italong dili sa kilid siya. Talong dili. Ayaw ital. Ian. Murag yan. Sa ganas kilid na.
Then one last thing also is to change also the punda sa sa patient.
Kaya nag-breaking na to.
Okay.
And then, this one, the rail, make sure to put the rail on a proper position so the patient will not fall. And then, Also raise the bed to the patient's kanang third position. Yeah, comfortable position.
Okay?
So that's it. Thank you, ma'am.
Sayod ko, isa to na. Katong walay palit kang, katong stick lang pala, orange stick.
Sila Clinton ako.